Good morning. Bonjour. Just going to wait another minute to let people arrive. I can see a lot of people are arriving. On va donner quelques secondes aux gens qui arrivent toujours avant de commencer la session ce matin. Bienvenue tout le monde. Welcome everyone. Okay. So it looks like a few people are still joining. But I think we will begin if that's okay with everyone. Je pense qu'on va commencer. So good morning, everyone, and welcome to today's Child Care Sector Information Session, hosted by the City of Ottawa's Children's Services within the Community and Social Services Department and in partnership with Ottawa Public Health. My name is Anne Meloche, and I am a Program and Project Management Officer in the City in the Community and Social Services Department, and I'm very pleased to be your MC today. Bonjour à tous et à toutes et bienvenue à cette séance d'information pour les fournisseurs de services de garde d'enfants, organisée par les services à l'enfance de la Direction générale des services sociaux et communautaires de la Ville d'Ottawa, en partenariat avec Santé publique Ottawa. Mon nom est Anne Meloche et je suis agent de gestion de programmes et de projets au sein des services sociaux et communautaires de la Ville d'Ottawa. Je serai votre maîtresse de cérémonie aujourd'hui. The session will provide you with an opportunity to hear directly from Ottawa's Medical Officer of Health, Dr. Vera Etches, and to learn more about recent updates to public health guidance. Our goal is to support the critical work that you do to provide essential services to Ottawa families. Today's session is being recorded and a link will be shared with you by email afterwards. Cette séance d'information vous donnera l'occasion d'entendre directement la médecin en chef de la santé publique d'Ottawa, la Dr. Vera Etches, et d'en apprendre davantage sur les récentes mises à jour des directives en matière de santé publique. Notre objectif est de vous appuyer dans votre travail essentiel afin de fournir des services aux familles d'Ottawa. La séance d'aujourd'hui est enregistrée et un lien sera partagé avec vous par courriel par la suite. So before we begin, I would like to take a moment to honor all First Nations, Inuit, and Métis people and their valuable past and present contributions to this land. As the Department, Community and Social Services recognizes the continuous and intergenerational impact of colonization that Indigenous people have endured. We want to learn from these events and prevent current perpetuation of racism, while we commit to learning more about the vibrant contemporary Indigenous cultures and communities, as well as those that predate us. On veut profiter de ce moment pour se rappeler qu'Ottawa est bâti sur un territoire non cédé de la nation algonquine Anishinaabe. Les peuples de la nation algonquine Anishinaabe vivent sur ce territoire depuis des millénaires. Leur culture et leur présence l'ont enrichi et l'enrichissent toujours. Et maintenant, quelques mots de l'affirmation dans la langue algonquine. Nimanaji ananik, mami winini anishnaabek, ogug, ka, nagadawa bagajig, io aki, eko weshkad, ako, nongum, egawikad, kimiwegwach, miigwech. Thank you, merci. The session today will include a Q&A segment with Dr. Etches, responding to some of the questions that you have submitted in advance. In addition to the many questions you have submitted, thank you very much for those. This Teams live session offers a chat feature that allows you to type additional questions throughout the session. So you will find the Q&A button at the top right of your screen where you see two little bubbles with a question mark inside. Okay, so we will not have time to answer all your questions probably today, but Children's Services will continue to work with Ottawa Public Health to ensure content is covered in other formats. Of course, you're always welcome to call your child care specialist or email Children's Services with questions or additional comments you have at any time. Our email is the same one used to send the invitation to this meeting. Nous vous remercions d'avoir soumis vos nombreuses questions à l'avance par courriel au service à l'enfance. Alors, les questions ont été examinées et ont contribué à la préparation de la séance d'aujourd'hui. Certaines questions seront répondues par la Dr. Etches dans le segment questions et réponses de la présentation de ce matin. En plus des questions déjà soumises, cette session offre une fonction de clavardage qui vous permet d'ajouter des questions supplémentaires tout au long de la session. Alors, vous trouverez la fonction de clavardage sur le bouton dans le haut droit, à droite de votre écran, et où il y a deux petites bulles avec un point d'interrogation à l'intérieur. Alors, nous n'aurons pas le temps probablement de répondre à toutes vos questions aujourd'hui, mais les services à l'enfance s'assureront que le contenu sera couvert d'une autre façon, d'accord? So, to begin, I would like to introduce Jason Sabourin, Director of Children's Services at the City of Ottawa, with a brief welcome message. J'aimerais maintenant vous présenter Jason Sabourin, Directeur des services à l'enfance de la Ville d'Ottawa, avec un bref message de bienvenue. Jason.
Merci, Anne. Thank you, Anne, for the warm start to today's session. Children's Services is pleased to host another information session in partnership with Ottawa Public Health. Just a quick note of appreciation to all the team members that quickly came together to organize this information session to support the sector. As Consolidated Municipal Service Manager, Children's Services is responsible for the planning and management of licensed childcare and early years programs and services for children from 0 to 12 years old in Ottawa. This includes coordinating and planning at the system level to ensure services are responsive to the needs of families. Planning and collaborating with our sector has never been more important than it is right now. Les services à enfants sont responsables de planification et de gestion des services de garde d'enfants agréés et des programmes et services de la petite enfance pour les enfants de 0 à 12 ans. Cela comprend la coordination et la planification au niveau du système pour assurer que les services répondent aux besoins des familles. La planification et la collaboration avec notre secteur n'ont jamais été aussi importantes. It's a pleasure to have Dr. Vera Etches here with us today. And before I turn the floor over to the Medical Officer of Health, on behalf of my team and the many families who rely on your services, I want to take a moment to recognize all of you working tirelessly in the childcare sector and thank you for joining us today. As we surpass the second year of COVID-19 pandemic, I know you have been stretched thin and adapted to change over and over again. The highly transmissible Omicron variant is still present in our community, and I want to thank you for the critical work you continue to do in providing a safe, engaging, and healthy environment for kids to thrive and the many other benefits these essential services bring to families. I know how challenging it is once again to have provincial guidelines change quickly, and we're all left with many questions. We continue to work with the ministry on highlighting the concerns of the sector and Ottawa Public Health, who have helped us throughout the pandemic to adjust and adapt to keep everyone as safe as possible. Les services d'enfants sont heureux de tenir cette session d'information avec Centre public Ottawa. Nous faisons la deuxième année de la pandémie et je vous remercie pour votre travail dans notre communauté. C'est avec plaisir que je souhaite la bienvenue à Dr. Etches. It is my pleasure to now welcome Vera to this meeting. And on behalf of Children's Services, thank you for your leadership and staff expertise as we work together on our continued journey to ensure childcare and early years programs are supported. Thanks, Vera. You're still on mute, Vera.
Didn't want to disrupt you earlier, so that I think you can imagine I'm saying thank you to Anne, bonjour Quay to everyone, thank you Jason. And it truly is really wonderful that our teams could work together to host something like this. I know there's a lot of conversations and connections being made one-on-one with organizations and individuals, but also that more broadly, this is a time of transition, and sometimes it's helpful just to hear collectively some of the key things and hear your questions and answer them for many people all at once. Il me fait grand plaisir d'être parmi vous ce matin, and I would also like to acknowledge that we are meeting and working here on the unceded territory of the Algonquin Anishinaabe people. So certainly, I feel that this pandemic has highlighted the essential role that you play in providing childcare services and supporting children's development. I have been so impressed, continue to be impressed with how you are persevering. It is truly an essential service that you're providing, and I know people very much appreciate it, the parents, the community, and yet it's hard. This has been a long time. I do know that, and so I hope you can feel the appreciation and also a way forward. You know, one thing I noticed on my team is that it feels like there's just wave after wave, and maybe harder to see that things are changing. Mais il y a l'espoir pour l'avenir. Ce n'est pas juste une vague après une autre vague et c'est la même. Maintenant, nous avons la protection de vaccination. On a une approche avec les changements, on va discuter aujourd'hui, où c'est un peu plus normal, un peu plus comme on traite le COVID-19 comme les autres virus respiratoires. So I do hope you can also see some hope that we're on a path into the future where things will be more normal. We'll treat COVID more like other respiratory illnesses, and that's what some of the transitions, you know, in the guidance are getting us towards. It is feeling like one wave after another, but we have more protection now from vaccination. This is clear. And yet, of course, Omicron's challenged us because it's so transmissible. It's come all at once. But I do want to say that I can see a better future ahead, and we will get there together. So I think that it is the January 10th provincial guidance that we're all trying to adapt to. So Ottawa Public Health, you know, have been working to try to understand the changes in the provincial guidance and then support the childcare sector to put this into place. The overarching change, it really is a work towards less trying to actually contain and stop COVID transmission, because Omicron is showing us that's just, you know, not how this virus behaves, that we can stop it completely, but to mitigate the serious illness. And so this is behind a lot of the need to prioritize, you know, how we protect people in long-term care homes and retirement homes, and think about the most vulnerable people in our communities. So I will do my best to talk about you know, the changes in the guidance. We have shared a letter to childcare provider and parents outlining the difference in the testing and isolation guidance. These you know, letters are on our webpage, so they have more information in them about how we're talking to people about the change in testing and isolation. It really is about encouraging families and staff each day. The simplest thing is to use the screening tool every day to see if there are some COVID symptoms or symptoms that would require people to isolate. It really comes down to that is the most important thing after vaccination. Get vaccinated beforehand. So that, you know, it is something still, though I know there are a lot of questions. So we're going to keep working with you and providing more tools to help answer parents' questions as well. Encore une fois, nous sommes très reconnaissants des efforts continus afin de prendre les mesures nécessaires afin d'assurer la mise en place des nouvelles exigences, et nous comprenons à quel point cela peut parfois créer de la frustration et de la confusion. So thank you for working through this with us. It is sometimes not always as clear as it needs to be for you. So the recommendations in terms of the measures you have in place to slow COVID transmission in childcare settings haven't changed. Those kind of screening tools, using the masks, those are all the same. What we know is that there's less access to testing for the general public, and so this symptom-based approach, asking people to think about their symptoms each day, is the foundation. It will slow transmission when people stay home when they're sick, and I think that's also a key message I have for the whole population. You know, just if you stay home when you're sick, it means that you will protect against onward transmission. And how long you need to stay home, that has changed a little bit. The isolation recommendations are now 5 days for many people who are vaccinated, under 12, and they do extend to 10 days in certain circumstances in high-risk settings or with immunocompromised, unvaccinated people. So the screening tool each day, it walks people through that. So they'll get the right advice by just following each step of the screening tool. The other thing is that in the new provincial guidance, we don't see school and childcare settings generally being considered high risk for COVID transmission, given the different protective barriers that are there, and the outcomes of severe illness also being much different for children compared to older adults in more high risk settings. So we are working on tools to help childcare providers assess if they think there has been a high risk contact in your settings. Then that is something we can help you understand, and we'll work with you, to try to work on what's the response in those situations. What we're focused on without as much testing and in the guidance is using absenteeism as a key method to inform parents. So not informing after a test, or but using information about increasing rates of absenteeism. So this will have certain thresholds. The province talks about 30%, but we're going to be interested in hearing about any concerning pattern. So I think maybe a key message to take away today is, si vous avez des préoccupations, appelez-nous. So if you have concerns about should I be doing something more here to notify parents or staff, just call us, and we want to provide support through this transition. And I think certainly it probably do need to come back to the idea that vaccination is an important protection, that we know many staff have had the 2 doses. The 3rd dose, I do want to underline, it is very useful to protect against hospitalizations and death. People who are vaccinated are getting infected with the Omicron variant. This is the way this virus is working. That's partly why it's so hard to stop and control the transmission. But people who are vaccinated are very much less likely to end up in hospital or needing intensive care units. And so there is also information about how this variant, the Omicron variant, affects children. And it looks like children are much less likely to be hospitalized with Omicron compared to earlier variants. So it is causing less severe disease in children as well. And we know that those younger children aren't vaccinated. So we are still encouraging, though, because of the protection of vaccination for adults, anyone around children to be vaccinated. And vaccination can decrease a bit the transmission, so that it can make it less likely that you'll pass on the virus. So this is our message again for all around children who can't be vaccinated to be vaccinated. We are making progress in the booster doses in Ottawa, and yet we're also at a point where we have as much capacity to vaccinate as there seems to be demand. Alors, si quelqu'un a besoin d'une COVID-19, vaccin pour COVID-19, c'est disponible maintenant sans rendez-vous. So you can just present at any of our clinics, and all that information is on our website. We're seeing the uptake in children 5 to 11 also continue to grow. We have one of the higher coverage rates there in the province, and we want to see it keep growing. So we know that 12 to 17-year-olds have very high vaccination coverage rates, so we're aiming to bring the younger children up to that. Aussi, j'imagine, il y a des questions concernant la vaccination pour les enfants qui ont moins de 5 ans, et ça va arriver. C'est probablement quelques mois. C'est pas immédiat, mais on a les signes que ça va arriver dans quelques mois. So I think the other thing is you support families, and yourselves, this is a difficult time. I want you to know there are supports for people who are struggling, and also for you to know there are supports for families. It's okay to not be okay. We have times like that in this pandemic. C'est normal de ne pas se sentir bien. So our website also has a lot of list of solid mental health and substance use also related resources and supports. There's a better system now for children to access support through a portal, all the services aligning behind one point of access, one call, one click. Of course, for people in crisis, we have the crisis lines listed as well. And I do encourage employers to think about how we can support the mental health of our employees. And so please don't hesitate to reach out for this kind of information as well. As I said at the beginning, I am still hopeful about where we're going. I think we're on a path that will get us through this wave and carry on. And I'm just so thankful that you were there supporting families and children and each other. Alors, merci beaucoup pour votre travail et pour cette invitation. Je pense qu'il y a des questions maintenant. Et je ne sais pas si j'ai... OK.
Parfait. Thank you, Jason. Thank you, Dr. Etches, for these inspiring and informative words. Merci, Dr. Etches et Jason, pour vos remarques. We will now proceed with the Q&A segment of this section. So as mentioned previously, Dr. Etches will be answering some of the questions that you have provided prior to this session. Okay. So the first question is in English, Dr. Etches. Okay. Does an individual experiencing symptoms need to isolate and seek testing after having recently recovered from COVID-19? Or can they assume to be immune for 90 days?
Thanks, Anne. I know there's a little bit of a lag when the video switches over, so I hope I'm handling this okay for you. I do want to make it clear that if an individual develops new symptoms, those symptoms that could be COVID, like a fever, a cough, some of the other symptoms that can come together, like a sore throat or headache, and that they should begin isolation again. And you can still then again use the testing if it's eligible. If you have a rapid antigen test, you should follow the screening tool, which will point to what's needed for those symptoms. But isolation is needed again. We're still learning about how a recent infection with Omicron can impact our immunity, but other infections come along as well, and they can be transmitted to others, and then others would have to isolate. So it's always good to stay home when you have symptoms of illness. We know that it is possible to have reinfections as well. So as we go forward, we do need people, even in that 90 days where you might have maybe stronger immunity to Omicron, to still follow these guidelines. And we'll be monitoring the situation too. There are new variants that may come along. We'll all be going through this together, but that isolation when you have symptoms is still key. It helps with reducing respiratory illness, and you can still use a test to see if it's testing positive for Omicron. hope that answers the question.
Thank you. As Dr. Etches says, I want to make sure people understand there's a 30-second delay between switching between myself and Dr. Etches. So it's the technology. So bear with us. Thank you for that. Il y a un délai de 30 secondes entre quand les caméras changent du Dr. Etches à moi. Alors, je voulais juste vous assurer que c'est la technologie qui nous demande ça. Alors voilà. Alors, d'ailleurs, la prochaine question, Dr. Etches, est en français. La question est la suivante. Comment les parents des enfants au service de garde sont-ils informés que leur enfant est possiblement en contact étroit, tenant compte que les parents ne sont pas requis d'aviser les services de garde des résultats des tests PCR ou TAR? Vous êtes sur mute, Dr. Etches. Vous êtes encore sur mute.
OK, je vais juste laisser le mute. Je pense que ça va fonctionner mieux. Oui, OK. Alors, l'avis. Chacun est responsable d'informer ses contacts et les avis qu'ils doivent s'isoler lorsqu'ils croient être affectés par la COVID-19. Et si une famille s'isole à la suite d'un résultat positif au test de dépistage et qu'elle craint qu'il y ait des contacts dans le service de garde selon le moment où l'enfant y était présent, elle peut communiquer avec le fournisseur de services de garde d'enfants. Et Santé publique Ottawa a élaboré des outils pour aider les fournisseurs de services de garde d'enfants à déterminer les personnes qui ont pu être en contact avec l'enfant afin que le fournisseur puisse aider la famille à transmettre l'information au contact dans un service de garde d'enfants. Mais en général, si toutes les précautions de santé et sécurité sont en place, il ne devrait pas y avoir d'identification de contact étroit en service de garde. Je sais que c'est différent avec les petits enfants, mais nous savons que les enfants seront parfois à moins de 2 mètres de distance l'un de l'autre et c'est sans masque. Alors, toutefois, nous aimerions aider les fournisseurs de services de garde à identifier ces expositions potentielles afin d'informer les familles. Et les familles seront également informées s'il y a une forte augmentation des absences dans un centre de garde d'enfants qui amènerait à penser qu'il pourrait y avoir transmission de COVID-19 ou une différente infection respiratoire dans le milieu de garde d'enfants. Lorsque cela se produit, nous travaillons en étroite collaboration avec les services de garde d'enfants pour déterminer les soutiens nécessaires et renforcer les mesures de santé publique appropriées dans ce centre. Et pour maintenant, le changement, c'est si quelqu'un habite avec quelqu'un qui a le COVID-19, tous les gens dans le foyer ont besoin d'être en isolement pendant la période avec les symptômes pour la personne positive. Et c'est différent maintenant pour les gens dehors le foyer. C'est moins souvent que les gens dehors le foyer sont des contacts à haut risque. Alors, il y a un changement là aussi.
Merci beaucoup, Dr. Etches. Next question is in English. So how will child care providers determine who is a close contact within a group or a cohort?
So a high-risk contact is someone who is in close contact with a person who tested positive for COVID-19 during this time when they could transmit the virus to others. It's that period of communicability, we call it, is 48 hours before their first symptoms started, or 48 hours before their test if they didn't have symptoms, and then until their self-isolation period has ended. And that close contact means being within 2 meters of a person who had COVID-19 for a prolonged period of time, or multiple close encounters without other protections such as masks. And so we know there may be some tools helpful to assist childcare providers in identifying the contacts that have this kind of close contact and to pass on the message to close contacts in a childcare setting. And so please, and I think these tools are just about in place. They're being discussed with you, but if you're uncertain, just phone our line, our infection prevention and control line at Ottawa Public Health, and then these tools will be on the web soon. We know that that this is different from the previous, where we considered anyone in a cohort was considered having enough contact to be asked to be in isolation. So that is different. We're not just considering a whole cohort necessarily to be at higher risk or to require that isolation, both in childcare and in school settings.
Thank you. Thank you for that. Okay, the next question is, are child care providers required to contact OPH when a staff or child obtains a confirmed positive test result from PCR or RAT test?
Okay, so it's the Ministry of Education that is going to be providing instruction to childcare licensees about how to report, what the reporting requirements are. And so it would be the Ministry of Education that will have more information about this in terms of the absenteeism or any other reporting required of childcare settings. What we know is that given how widespread COVID is in our community right now, and that we can't test every person with symptoms, we're moving again to this risk mitigation approach, just trying to slow the transmission, protect people more vulnerable to serious illness. And so we aren't going to be following up as Ottawa Public Health with every person who tests positive in school or in childcare. And as I just mentioned, we won't be using this information to dismiss cohorts and ask everyone in a cohort to isolate. But childcare providers will be continuing to monitor absences. They will be reporting absenteeism rates, and Ottawa Public Health will be looking at this information. We'll be watching, and whether, helping childcare understand whether this is important to put in place other measures. So Ottawa Public Health won't be doing that reporting. That will be Ministry of Education reporting on absenteeism. And so they'll have their tools, and we'll continue to learn about how this process is working and work with you.
Perfect, thank you. La prochaine question est en français. Est-ce que les fournisseurs de services de garde et les enfants qui ont accès aux tests de dépistage sont encouragés à se tester, même s'ils n'ont qu'un symptôme, genre le nez qui coule, ou s'ils devraient seulement s'isoler et avertir leurs contacts étroits?
Alors ça, c'est une bonne question aussi. Toutes les questions sont bonnes. Si un individu a quelconque symptôme, c'est important de s'isoler dès que possible. Mais par contre, il y a présentement deux types de symptômes. Alors, symptômes majeurs qui nous indiquent que la COVID-19 est très probable, en particulier dans ce moment avec beaucoup de COVID dans la communauté, et tels que la toux ou la fièvre. Comme ça, les symptômes mineurs aussi, tels que le nez qui coule ou les maux de tête. Ils sont moins étroitement liés à la COVID-19. Alors, avec deux symptômes mineurs ou un symptôme majeur, il faut soupçonner la COVID-19, s'isoler et avertir les contacts étroits. Même sans test de dépistage qui détecte une infection après qu'elle ait eu lieu, nous sommes encore capables de protéger nos proches en empêchant la transmission de la COVID-19 en premier lieu avec l'isolement. Ce que nous pouvons faire aujourd'hui, demain et à l'avenir, exactement ce que nous avons si bien fait au cours des nombreux derniers mois. Et si un test de dépistage est disponible, ceci peut servir à éliminer le diagnostic de la COVID-19 et donc il sera possible de terminer l'isolement dès que les symptômes se sont améliorés depuis 24 heures ou 48 heures en cas de symptômes gastro-intestinaux. Je pense que les services de garde sont familières avec les différences avec les symptômes gastro-intestinaux. Et dans le cas où l'individu n'a qu'un seul symptôme mineur, tel que le nez qui coule, nous recommandons de s'isoler jusqu'à ce que les symptômes se sont améliorés depuis 24 heures et 48 heures en cas de symptômes gastro-intestinaux. Dans ce cas, il n'est pas nécessaire d'aviser les contacts étroits car la COVID-19 est moins probable. Un test de dépistage n'est pas nécessaire dans ce cas et ne raccourcira pas le temps d'isolement. Alors, j'espère que c'était clair. Un test de dépistage n'est pas nécessaire dans ce cas et il ne raccourcira pas le temps d'isolement. Au bout du compte, il est important d'utiliser l'outil de dépistage pour les écoles et les services de garde chaque jour avant de quitter la maison et de suivre les instructions que l'outil nous donne après l'avoir complété. L'outil donne le bon avis et c'est là où on recommande, on utilise l'outil provincial parce que s'il y a des changements, ils ajoutent les changements dans cet outil.
D'accord, merci beaucoup. Alors, on poursuit en français avec une autre question. Alors, est-ce qu'un enfant peut retourner au service de garde après avoir obtenu un résultat négatif de TAR?
Un individu symptomatique obtient un seul résultat négatif d'un test de dépistage antigénique rapide devrait continuer de s'isoler. Mais par contre, si ce même individu, dans les 24 à 48 heures suivantes, reçoit un deuxième résultat négatif d'un test antigénique rapide, le risque que l'individu ait une infection à la COVID-19 est moindre. Donc, celui-ci peut terminer l'isolation lorsque les symptômes ne se sont améliorés depuis au moins 24 heures ou 48 heures en cas de symptômes gastro-intestinaux et sans l'utilisation de médicaments pour réduire la fièvre.
Bon, d'accord. Alors, tantôt, vous avez parlé de taux d'absentéisme. Alors, qu'est-ce qui est considéré comme un taux d'absentéisme élevé? Est-ce que le taux d'absentéisme est déterminé basé sur l'absentéisme d'un groupe ou du service de garde?
Oui, comme l'indique la note de service du ministère de l'Éducation datée du 13 janvier, lorsqu'un établissement de garde d'enfants affiche un taux d'absentéisme de 30% et plus à l'échelle de l'établissement, il doit le signaler directement au bureau de santé et informer à la communauté de services de garde d'enfants. Mais cependant, si vous constatez des augmentations significatives d'absence dans une cohorte spécifique, tel qu'un dédoublement des absences sur quelques jours, des rapports de symptômes inhabituelles ou d'autres inquiétudes, vous pouvez en discuter davantage avec Santé publique Ottawa en contactant notre ligne téléphonique sur les épidémies, car il existe d'autres maladies transmissibles que nous voudrions également suivre et nous avons toujours travaillé main de la main avec les services de garde lors des éclosions de maladies infectieuses et ceci ne changera pas.
On retourne au Dr. Etches, s'il vous plaît, pour qu'elle termine son idée.
Oui, mais c'est juste que je reconnais qu'il y a beaucoup de questions en français et peut-être je peux juste donner quelques points en anglais aussi. Est-ce que c'est utile? Je ne sais pas. Je peux retourner, je pense à d'autres questions, mais par exemple, there was a question about what if someone just has one symptom, should they do the rapid antigen test? So again, using this daily screening tool will tell you if they're major symptoms. Yes, one major symptom, you can use the rapid antigen test and that will help you understand if it's not COVID, you have to have 2 negative tests in a row, 24 to 48 hours apart, then that may help you end your isolation earlier and your family members. But if it's just one minor symptom, it doesn't change how you approach things. And so continue to follow the screening tool each day will give you the best instructions around how to use the tests and what isolation is needed. So I think I've covered a couple things there. And the other was that we will be looking at rates of absenteeism. The ministry's document says 30% in an organization. But we will be also interested in hearing from operators if they're seeing something different, like in a cohort, doubling of the absenteeism or, different kinds of symptoms that are significant. We still want to hear about things that are giving you concern. And so please just continue to work with us. So I think those are a few key points that were covered in French's.
Thank you for that, Dr. Etches. A great summary. So the next one is the last question that we've received in advance, and then we'll have a look to see if we have received questions during our session so far. So here's the last one. Can a child returning to childcare after isolating after experiencing COVID-19 symptoms have lingering symptoms even after 7 to 10 days, such as a cough and or a runny nose?
So the general rule, of course, is people with symptoms must stay home. And that means staying home if someone else in your household has even a symptom. But the isolation requirements can differ depending on what those symptoms are and vaccination status and a person's age. So it is important to use the instructions that are provided when completing the daily screening tool. And so that for people who had COVID-19 symptoms and they've completed their isolation requirements, whether it's the 5 days or the 10 days according to the tool, like what their requirements were, then isolation can end when the symptoms are improving for at least 24 hours, or what I was saying in French, the 48 hours is for gastrointestinal symptoms, and that of course has to be the symptoms are improving without the use of fever-reducing medication. But it is possible that people would have some lingering symptoms, and we understand that. So the tool will point you in the right direction.
Okay, so I'm having a look right now at our questions received. Je suis en train de regarder voir s'il y a des questions qu'on a reçues de vous pendant la session. Une petite seconde. Okay. Okay, voilà. Okay, Dr. Etches, I have an English question here. So how can we alleviate our parents' anxiety about bringing their children to daycare? We have parents who are very afraid of exposure for their children because we are not reporting cases to them anymore.
I do think this is one of the hardest aspects of the transition for parents because obviously it feels like if we have more information, we could make more informed decisions. So what I think of is the broader context. So what we know, broadly speaking, is that COVID transmission occurs more often in the community, in social settings, in household settings, than it does in schools and childcare, because childcare centers have more layers of protection to keep COVID out. You have the daily screening, you have the masks, you often have distancing. You might not have masks for all the little children, I know, but these measures collectively do decrease the risk. And so I know we're trying to also do our part to provide parents with information that we will be still looking at the situation in the community and in children settings like schools and childcare to inform parents if we're seeing something change that's significant. And also I try to bring it back to what's in our control. What is in a parent's control? It's that they can protect their family by being vaccinated. They can protect against transmission of COVID by doing that daily screening. And it is hard to try to also say, because it numbers and facts don't really necessarily work very well to counter fear, but children are rarely hospitalized with COVID-19 infection. So if there was an infection in a community setting, anywhere related to childcare, it's not likely to have a negative outcome. Like, most children are going to manage this at home with support, so I know if the fear is there, and we're going to keep trying to help people through this. What you can reassure people is that the experience to date in the pandemic has been that the measures in place have limited transmission of COVID in childcare settings, and that you're continuing those measures, and that if you are seeing something concerning, that you will be working with us to let parents know. It is the case. Some families may be more vulnerable. They may have concern for other more vulnerable people at home. So some families will make a decision, that's best for them, considering their level of concern. So that also, I guess, is in families' control. I try to recognize that people do need to make the best decisions for their families.
Thank you, Dr. Etches. Not an easy question. Not an easy answer. So I just want to remind people that that you have the potential. We have a few minutes, which is fabulous, to be able to ask other questions of Dr. Etches. So I'll just remind you where the Q&A button is. So if you look at the top right in your screen, you have those two little talking bubbles with a question mark in the middle. You just click on that, and then you go to the bottom of your screen on the right-hand side, and you can type your question in there if you have one, of course. Alors, je veux juste vous rappeler, parce qu'on a quelques instants encore que vous pouvez demander des questions au Dr. Etches. Alors, je vous rappelle où est le bouton de clavardage. Alors, à votre droite de votre écran, il y a 2 petits ballons avec un point d'interrogation à l'intérieur. Alors, vous avez simplement besoin de cliquer là-dessus, puis aller au bas de l'écran et puis d'insérer votre question. Alors, Dr. Etches, vous avez la main levée. Allez-y.
J'attends pour le...
Oui, Pat, we need to go back to Dr. Etches, please.
OK, oui. Je pense, je voudrais aussi, peut-être en français ou en anglais, juste aussi expliquer quelque chose de différent entre les écoles et les services de garde. Because in my remarks earlier, I spoke about how we are working with childcare sectors where there could be some high-risk contacts identified. Not that we're dismissing a whole cohort, but there may be situations, and that is different from sort of the overall guidance for schools and how we walk things through for people with the new guidance on our website for schools, because you know, it is clear we're not dismissing cohorts either in schools or childcare settings, and the difference with childcare, you know, we're open to this. Let's explore if there's potentially a high risk contact somewhere. It's because of the young age of children and their inability to wear masks, and you know, some of the nature of the interactions compared to older children. Alors, c'est un peu différent entre les écoles avec les enfants plus grands et les jeunes enfants qui n'ont pas la capacité de porter les masques. Alors, c'est pourquoi j'ai mentionné quelquefois, c'est possible, nous sommes ici pour aider les services de garde d'enfants de contempler s'il y a un risque un peu plus haut d'exposition à COVID-19. Dans les écoles, les plus grands enfants, on porte les masques, c'est un peu différent. Alors, mais dans les deux secteurs, on n'a pas l'approche d'isoler une cohorte entière. So I just hope that might be helpful to clarify if people are looking at our website, you know, the overall approach, and then, you know, trying to support you in childcare.
Great. Thank you very much. Okay, we have received another question in English. So, Dr. Etches mentions 48 hours for being in contact with someone who has been confirmed as positive with COVID-19. However, we were informed that the time frame is 72 hours for childcare centers. Could the time frame be confirmed for us?
Yes, this is part of the changing guidance and how tough it is sometimes to keep adapting. When Omicron was new and we were trying to be as cautious as we could about containment, my goodness, that wasn't even that long ago, right? That was just in December. We had a very first detection of Omicron in Ontario at the very end of November. The containment approach led to a little bit more strict approach in 72 hours of isolation after symptoms resolved. So that's not the case anymore. So you can stick with what I have said today about gastrointestinal symptoms and the 48 hours. You know, we need to see that period of time after symptoms resolve before people return to childcare. So it's more like other gastrointestinal illnesses. Yeah.
Okay, so I think that is all for the questions today. So thank you so much, Dr. Etches, for your remarks and your leadership during this pandemic. Children's Services has appreciated the tireless support of Ottawa Public Health during these very difficult months. I'd also like to thank everyone who participated in the session today for your interest, your thoughtful questions, and your commitment to supporting children and families in our community. Merci, Dr. Etches, pour vos commentaires et votre leadership au cours de cette pandémie. Les services à l'enfance ont apprécié le soutien inlassable de Santé publique Ottawa tout au long de ces mois très, très difficiles. J'aimerais aussi remercier tous ceux qui ont participé à la séance aujourd'hui pour votre intérêt, vos questions réfléchies et votre engagement à soutenir les enfants et les familles de notre communauté. So as previously mentioned, the session has been recorded in order to provide access to those not able to attend today, and details on how to access will be sent to you shortly. If you have questions about the session or other questions or comments, please feel free to forward them to the Children's Services email inbox, which is children's with an S services with an S at ottawa.ca, or through the specialist. Alors, comme indiqué précédemment, la session a été enregistrée aujourd'hui afin de permettre à ceux qui n'ont pu assister d'y avoir accès. Alors, les détails sur la façon d'y accéder seront envoyés prochainement. Si vous avez des questions au sujet de la séance ou de toute autre question ou commentaire, veuillez nous envoyer un courriel au service à l'enfance qui est service au pluriel à l'enfance à ottawa@ottawa.ca. Thank you so much, everyone. Have a great day. Merci beaucoup et bonne journée à tous. Au revoir. Thank you so much.